Hi, Kristen. My name
Hi.
is Michelle. I'm a student nurse, or I'm a student nurse midwife. What can I help you with today?
My main concern for this visit is that I'm a hairdresser, and I'm
Mhm.
concerned that some of the products that I use will be harmful to my baby. And I was
Okay,
just wondering, yeah.
that's a really good question. It's good that you're wondering what you can do to take care of yourself and have a healthy pregnancy. So currently, there's not too much research in the way of hairdressers and the products they use and how they affect the baby. But the research that's out there suggests that hairstylists are not at an increased risk for birth defects, miscarriage, stillbirths, or developmental problems or childhood cancers for the baby. So that's the good thing. The research says you're not at increased risk. Um, it the chemicals that you're using, the amount that you inhale or absorb through your skin, it depends on several things, which is the amount of the chemical in the product that you use, how often you're using the product, how many hours you work, the type of ventilation or air system in the salon, and the type of protective equipment you're using. So there are a few things that you could do to try to minimize your exposure to these chemicals. Um, so you want to try to stay away from working with permanent wave solutions, hairsprays, and permanent hair dyes. So those are some things that can get to you through your skin or your lungs. So try to focus on washing hair, conditioning hair, cutting or bleaching. Um, Make sure that the salon is well ventilated, and if there are any windows that you can open in the salon, make sure you keep them open if weather permitting. You could use pump sprays or wet styling aids instead of aerosol sprays. They're a little bit, they're less, they're, sorry.
You're right.
The pump sprays tend to give more of a stream instead of a very aerosolized, diffuse spray that you'll inhale a lot of. Um, you should cover trash cans and product containers when they're not in use, and wear gloves that the product manufacturer recommends. And don't eat or drink in the salon area. Um, since you'll be standing a lot, you want to try to take breaks, and that's just because it's not good for a pregnant woman to be standing too much. You could get really uncomfortable. Your feet could swell, things like that. So try to take frequent breaks. And if you could keep work hours down to about 35 hours a week, that would be ideal. But if you have to work more, just take more breaks. Um, I could give you a list, a printout of common chemicals that are found in hair products that you work with, and you could check the labels on the products and also the MSDS to see if these chemicals are in the products you'll be working a lot with. And if they are, you could try to stay away from those.
Thank you.
And
I appreciate that.
yeah, we will continue to monitor you and your baby, and we'll make sure that everything is going well.
So I know that you told me to stay away from permanent hair dye and like perm solutions. If I were to wear gloves and a mask, would it still be okay to use that? Because I feel like I can't turn my patient or my clients away because of my pregnancy kind of thing.
Right. So it depends on how often you are performing these procedures and using these products. So if you use gloves and wear a mask, you should be fine if as long as you're not doing like client after client after client is getting the perm or anything.
Okay, that's comforting to know.
Is there
Um,
anything else?
uh, my I was reading, actually, I was doing some research before my visit about the chemicals in the salon, and the website mentioned a word called teratogens, and I'm not really sure what that is. Can you please explain that to me a little bit more?
So a teratogen is, it's a medicine or a drug or a chemical that will have an effect on your baby. So teratogens cause birth defects, or miscarriages or stillbirths. So that's basically what those are.
Okay, so this is my first pregnancy, and I'm about 12 weeks along. So I did one prenatal visit, two maybe, and I was wondering if you could just give me like, I remember we went over it last visit, but I just want a reminder of things that could be harmful to my baby, not just associated with my nail salon or my hair salon. Like that's teratogen. That's a teratogen.
Teratogen. I am not prepared for that. I've got to be honest with you.
Okay. I don't know what else we're supposed to do, really.
I think that's good enough, honestly.
Okay. All right.
All right. I'll stop the broadcast.
Okay.